Premier Heather Stephenson. Thank you, Heather, for being here. You'll hear from Dr. Roussin and Lanette Siragusa just in a moment with their regular update. Manitoba and the world are navigating through an unprecedented health and economic situation with COVID-19. During this time, it is important that we applaud all our frontline workers, our emergency personnel, our teachers, our small business owners, daycare workers. Manitobans are stepping up and they are doing what they can to help flatten the curve, and we thank them for that. Manitobans have led the way by listening to the advice of experts, and I commend all Manitobans for recognizing the critical needs for social distancing and for proactive measures to keep themselves and others safe. Today, we are taking further decisive action by declaring a state of emergency in the province. This will be valid for 30 days, and prior to the end of that 30 days, of course, we will evaluate to see if there's a need to continue. This puts us on an emergency footing and gives us a readiness that we need in these uncertain times. Understand that this is a temporary measure. Understand that we do not enter into this lightly, but this is part of our need to respond to ensure that we can continue to assist Manitobans in doing our part to protect the well-being of all of us here and all Canadians and global citizens. We respect the rights and freedoms of our citizens. We have stood above throughout our history in protecting the rights and freedoms of others. Recently, of course, we have stood out and up on behalf of the rights of people who we feel have their rights threatened in another Canadian province by legislation that's been put forward there. And so we respect rights. However, we must continue to use every tool we have in our possible availability to flatten the curve here and to do our part to protect all Manitobans. The measures that we're taking today will enshrine, quite frankly, what has already been happening in Manitoba. We have not had reports of people violating the advice that Dr. Roussin and others have been giving. And so I want to say clearly that my promise and our government's promise to Manitobans is that these measures will end as soon as possible and will only be used if absolutely required. These measures provided under the Emergency Measures Act will allow us to react more quickly on a broad range of supportive actions that we can take to reduce the spread of COVID-19. We do not intend to implement the full intent of the Act in its initial application, but we need to make sure that we have measures in place to allow us to take responsive actions to protect the health and well-being of all Manitobans. We're hoping for the best, in other words, but we're preparing for something less than that as a possibility. We make this declaration today to ensure that the 50-person gathering limit is respected, as it has been, by all Manitobans. Social distancing is critical to flattening the curve, but it does not mean that we should be cutting ourselves off from the support systems around us. In other words, social distancing does not mean social isolation. Let's be very clear here. We're in this together. We need one another. Pick up the phone and call a friend, a family member, a neighbor. They might need assistance from you. They might just need to hear your voice. This is a time to support each other, to support our friends, our families, our communities. Pick up groceries, shovel walkways, donate blood. The response to that request has been impressive, and we ask Manitobans to continue to respond by donating blood. Also volunteering, something we're proud of here in Manitoba that we do lead the country in doing. Looking after the children of those who continue to work on the front lines. This situation is changing rapidly. Enacting a state of emergency is one way to give us further ability to be nimble and to support Manitobans, but there are many other ways, and I ask Manitobans to think of ways they can assist. We have a long history of dealing with challenges in our province. Whether it's blizzards in the winter or floods in the spring or drought in the summer, we've always risen to the challenge of stepping up and helping each other out. And our province is strong and it is resilient because of these things. We've taken steps over our time as Manitoba's government to better manage the affairs of our province and to be more resilient and to be more ready for situations such as this, situations that are difficult to predict but that occur in our province. Must be prepared for, and we have done that. Just yesterday, Manitobans will be interested in knowing, senior Canadian economists commented on the resiliency of Manitoba and said that because of responsible and prudent fiscal management, Manitoba is one of the leading provinces best positioned to deal with the social and economic consequences of COVID-19. And that should give Manitobans a greater sense of confidence and assurance going forward that we are going to be the home of hope, not only for the past 150 years, but going forward as well. I know that we're traversing some difficult and uncertain times. I want every Manitoban, and our government, my colleagues want every Manitoban to know how proud we are of Manitobans for stepping up, for working together, for helping their neighbors, and for taking every precaution and step necessary to help themselves and one another overcome these times together. But right now, what I'd also like to do is ask my colleague to share with you a really positive step that we're taking to help reduce the fear that some parents might have during this time. So I'll ask Heather if you could share with our members of the media and through them Manitobans your announcement today.
Thank you, Premier, and good morning, everyone. Our government is continuing to take unprecedented steps in response to respond to COVID-19 in every sector across all government departments. Based on the advice of the Chief Provincial Public Health Officer, licensed childcare centres are suspending services at the end of the day and for the next 3 weeks. During this uncertain and challenging time, we need Manitobans to rise to the challenge. We encourage you all to reach out to your friends, your neighbors, and your family members to help care for our children during this time. We are all in this together. Our government also made a commitment to you that we would develop a plan to ensure childcare is available for healthcare workers who need help so they can help fight this pandemic. Today, we are announcing the details of our plan. We are providing more than $27 million to give our frontline healthcare workers the help that they need. This pandemic requires all Manitobans to change how they live their daily lives, but it is clear that we are all willing to work together to find solutions. Our plan is a 3-step approach that respects Dr. Roussin's recommendations for social distancing while ensuring childcare options are available for frontline healthcare staff. Here is what we're doing. Step 1 assures continuity of funding for childcare centres. We will continue to provide licensed childcare centres with their full operating grant and subsidies totaling up to $7.6 million province-wide for this 3-week period. Step 2 identifies healthcare and other essential service workers who need childcare. Based on Dr. Roussin's advice, childcare centres can remain open and provide care for up to 16 children. Priority will be given to children of healthcare and other essential service workers. Step 3 ensures childcare workers can continue to provide care in their homes and communities if they choose. We are establishing a new $18 million grant program so that early childhood educators affected by centres closures can immediately access funds of up to $3,000 to begin independently offering childcare services in their homes or in their community. These services could include establishing home-based centres of up to 12 children as per Dr. Roussin's advice. This program will be delivered in partnership with the Winnipeg Chamber of Commerce and the Manitoba Chamber of Commerce effective immediately. We are also allocating another $2 million to create a trust that will provide capital grants to childcare providers to ensure safe, quality care. These funds can be used to help purchase immediate needs, anything from fire extinguishers and first aid kits to high chairs and books. This trust will be managed by the Winnipeg Foundation. We thank them and the chambers for stepping up to help us implement these programs quickly and effectively. I also want to make it clear for parents that we will be encouraging all childcare centers to reimburse you for any childcare services that you have prepaid for and not continue charging you for services that you can no longer access. And finally, I've heard from the staff, the directors, the boards, and everyone involved in childcare in our province that they are ready to step up and they're ready to help us. This has been a challenging time, and I certainly want to thank everyone for their patience. And I also want to acknowledge how incredibly important childcare workers are to parents, to children, and to our communities, and I want to thank them for their incredible hard work. Thank you, Premier.
Thanks very much, Heather, and thank you to you and your department staff for the great work that you're doing. We have time for some questions if anybody's interested, and then Dr. Roussin and Lanette Siragusa will be available to you.
By declaring a state of emergency, what extra powers does this give you to be able to do now? And you said there's certain things that you guys aren't intending to use in the act as well.
Yeah, what this puts us on an emergency footing, essentially. It doesn't mean that we have to enact every aspect of what the powers entail. Dr. Roussin will be able to give you more detail on the process of how this comes to be. I would just say this, it's a declaration under the Emergency Measures Act. We haven't done this before in Manitoba, apart from allowing mutual aid agreements, and a number of you have covered stories as recently as last fall, actually, with respect to the the ice storm. Mutual aid agreements with municipalities, sometimes with other provinces and states as well, for things like winter storms, floods, wildfire situations. So this is the first time in recent history that we're aware of a ministerial order being issued as a result of calling a state of emergency. Initially, we are doing this to ensure that we're able to act readily in the public interest to ensure public safety as events require. So this is to prepare us, to put us on that footing so that we're able to react and be nimble, if I can put it that way. Again, I just emphasize that this is not something we take lightly. We respect the individual rights and freedoms of all our citizens, always will. But and they've been responding really, really well. Manitobans have been doing what I believe Manitobans do so well, pulling together, stepping up, doing the right thing. And I will, if I could, I'll add this. We now have the mandate through law to be able to ensure the 50-person gathering. But I would ask Manitobans to participate. The best defense we have isn't just a government officer going and trying to stop a restaurant from. The best defense is if you come across a situation, and I encourage Manitobans this, you come across a situation where people are not observing the social distancing rules, I'd like you to go on the internet and tell everybody not to shop there. Don't go there. Don't honor that kind of behavior. In fact, it's a dishonor. It's unsafe, and I would encourage Manitobans to be defenders of the safety of all of us. This is not asking people so much to take the law into their own hands as to use common sense and to assist each other in protecting all of us.
What does that allow you to do? You said it's a mandate that allows you to now ensure there's no 50-person or more gatherings. In what way you can physically go in and shut them down now? This allows you that order?
A variety of what some would call draconian measures that will be necessary only if people are doing something they have not been doing. Up till now, we've had great cooperation. I'll just say, aujourd'hui, nous prenons d'actions décisives. Nous déclarons un état d'urgence dans la province de Manitoba, qu'il s'agisse des tempêtes de neige, des inondations au printemps ou sécheresse d'été. Les Manitobans toujours relèvent les défis.
Will law enforcement be directed to shut places down that don't observe this rule?
I'll let Dr. Roussin get into the actual applications, and I will apologize in advance for not having all the answers, because this is an historic thing. You know, we haven't done this ever before, but I believe Dr. Roussin will have some answers for you and some more specifics than I can give you right now.
Minister Stuckington, as far as childcare goes, obviously home-based providers previously had been allowed to have 8 children. Moving this to 12 children for home-based providers. Is there no concern for safety here? Obviously, they
Actually, there are existing home-based childcare facilities that do have 12. So this is based on the existing rules and regulations out there.
And with regards to the continuing to provide the licensed centers with their full operating grants and subsidies, is there any threat not to pay those if they're not operating and not taking up to 16 children for those essential workers?
Yeah, we've reached out and this is a very generous sector. We're encouraging them that in this special need, this time that we're in, certainly, we are hoping they will step up with their 16 spaces. I'm confident that the sector will step up and help out in this, but that funding will continue to flow.
And let's be clear, we want our child care sector to be healthy and robust after this is over. So we have an obligation to ensure that our centers are continuing to operate and able to operate as we do the succession strategies coming out of this challenge. And so I think this is a commitment we're making to ensure that such is the case.
So they won't be penalized if they are not running over this 2-week period where they had planned.
Yeah, this is to provide continuity. I mean, these are difficult times, and we will encourage them to provide that child care, and I know they will want to. We need to provide that child care for the frontline service staff who are out helping us fight this pandemic. These are extraordinary times, and we need people to step up, and I know this is a very generous sector, and I know they will help out.
Why not jump this to less than 50 people? I know we've seen in some jurisdictions them going to say we want gatherings of less than 10, going that extra step further.
Sure.
Is there, I know we've been saying less than 50 for a couple days now, and people seem to be abiding by it for the most part, but why not take it that one extra step?
It's a great question, and I think it's one that highlights sort of the challenges we face right now. We want to, I'll use a sports analogy here and just say, hurry up and then take our time. Do the necessary things right now, the short-term pain that we know we all have to share in to make sure we have a longer-term gain. So we're not making the decision today that it'll not change because we have to be nimble, we have to be ready. But we think we're taking the right steps based on science, and Dr. Roussin is the more qualified person to speak to this.
You know what kind of enforcement this would mean? I know in Ontario, there's Premier Ford was saying people could be fined $25,000 a day if they don't close shop.
No, the penalties are onerous, and they're there for a reason. They're there to deter behavior that's unsafe, unhealthy, and that it frankly is not in keeping with what Manitobans' reputation is as good citizens. So we don't make laws for the majority of people. We make laws as a consequence of the behavior of some in the minority. And that is not something we've seen yet, but if we see it, we want people to know we're serious about clamping down on it, and that is what these measures are there for.
Minnesota has made grocery store staff essential workers. UFCW wrote to you about that. What are your thoughts on that?
My thought is that our first line, and I'll use Heather's statement about health, about the frontline healthcare emergency personnel. Look, we value all our people. And let's be very clear that we know that in every occupational category there is pain right now, and we are doing our best to make sure that we address that. But the number one concern has to be making sure that our frontline healthcare personnel are able to get to work. And so our first step here is to protect the child care needs of those personnel. Going beyond that to a time, we hope soon, where we can then move on, we would then expand that child care provision to be there for other frontline emergency personnel. And this, I could say paramedics, but I shouldn't start. Police, we can go there. The sequential approach is the right approach. We can't, in this case, we can't be egalitarian, because if we have healthcare workers unable to provide services on the front line, we're going to add to our serious problem here. We need to address their needs first, and then we need to expand the availability of child care as best we can in partnership with those willing to expand their services in that regard. And we encourage child care workers to take us up on the offer of expanding their availability, their professional skills to provide services for others.
Given that big banks are doing some mortgage deferrals, will you be looking at suspending rents, some sort of rent assistance?
Well, as you know, we've expanded rent assist programs beyond what most other provinces do. So we are making millions of dollars available to people to assist them with their rent now, and we'll continue to do that. And there are other steps we'll be talking about, I expect, early next week that I think will be important to give a greater sense of security to those who, many Manitobans are going check to check, let's be frank, and so this is extremely stressful for people who don't have any emergency funds available. So we're looking to take steps which will assist in that respect, but I won't announce those today.
Concerning to see doctors from this province traveling to Curling Bonspiel when all sorts of different restrictions and stuff like that.
It's the first I've heard of it. We have travel advisories out nationally. I would hope that people would respect them and make sure that they abide by them. But I can't speak to this individual case because you just made me aware of it. I must admit, as a curling fan myself, I share the sadness of all of us that we aren't going to be able to see the World Championships with Manitoba teams participating. That's sad, but the fact is that we have to do the right thing for all of us right now, and this is the right thing to do, is to stay closer to home, avoid any unnecessary travel, and so that's what we encourage all Manitobans to do.
Schools are going to be closed for 3 weeks now. Is there any thought about, given what's happening in different jurisdictions, them not coming back at all the rest of the school year? And if so, what happens to grade 12 credits?
Yeah, it's a great hypothetical question, and it is just that. Others have, we're thinking about all eventualities. I would just say we're taking all the necessary steps that we can to address short-term needs while also giving serious consideration to mid- and long-term needs. And I think that's a characteristic of this government that most would acknowledge. We have been taking a view from the time we were first elected, not just to deal with the short-term issues, but to strengthen ourselves to be able to deal with the mid- and longer-term issues. I have heard speculation from spokespeople, for example, in Alberta, about not reopening schools. I'll just simply repeat the adage, we're hoping for the best, and we have to also prepare for something less than that as well. So we are going to deal nimbly, with agility, with the circumstances that we face, and we are already in discussion at both at the ministerial forum level and across departments on how to be proactive in dealing with other issues that may emerge. And this is critically important that we don't get, well, the adage about alligators. We can't just get hung up in the temporary circumstance we have to face. We have to face it first because it's a priority. That's why we're talking about childcare for emergency personnel today. But we are also already dealing with the anticipatory possibilities of other measures.
Are you able to provide an update on the mass purchasing of the PPE deal with Ottawa?
I think the health minister will be able to give you more. I just had a verbal on that. It was progressing well. I should mention, and I'm endeavoring. I have to say that I appreciate, and I've said this to the CBC yesterday, I appreciate the federal government's series of financial offers. But I must say, the health care issue remains. And if it wasn't apparent to Canadians before of the need to strengthen the partnership and re-establish the partnership between the federal government and provinces on supporting and funding health care, it is very apparent now. And the federal government's offer of financial support, though appreciated on health care, is tiny. Our share of that envelope will not pay for 1/2 of the masks and protective equipment that we have had to order to deal with this issue, let alone all the other additional costs of providing health care for COVID, let alone all the other additional accelerating costs of an aging population. So I put this marker down now. Thank you. Thank you to the federal government for their variety of programs they've announced. We appreciate it. But let's get to the table as soon as possible and reestablish some confidence in our partnerships around funding health care for the country of Canada. That needs to be done, and it needed to be done a long time ago.
Mr. Premier, does this open up the step to closing down everything but essential services?
I'm sorry, I missed the first part, Brittany.
Open up towards shutting down everything but essential services like grocery stores? Is that kind of the first step by ordering this declaration?
I wouldn't want that to be taken from this. We're taking the measures we need to be sure that we're adhering to the advice of our medical experts. That advice has not been given. The advice of shutting down other facilities has not been given to us. The consequences of doing so are very significant for many. So I wouldn't want this measure today to be misinterpreted as the first step down a slippery slope to everybody just having to live on their own in a cave somewhere, because that's not what we're after here. And again, I'll repeat, social distancing does not mean social isolation. We have mental health challenges in our province, across country, around the world right now, that aren't going to be assisted by people living in fear.
Good morning. Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer. As you have just heard, the province has declared a state of emergency. Today I am issuing orders under the Public Health Act to reinforce the social distancing measures that we have already been applying. The following measures will be in place effective 4 p.m. today and will be in place for a period of 30 days. We are limiting public gatherings to no more than 50 people at any indoor or outdoor place or premises. This includes places of worship, gatherings, and family events such as weddings and funerals. This does not apply to a facility where healthcare or social services are provided. Retail businesses, including grocery stores or food stores, shopping centers, pharmacies, gas stations, can remain open but must ensure separation of 2 meters between patrons assembling within the business. Public transportation facilities must also ensure that people are reasonably able to maintain a separation of 1 to 2 meters from each other. We are limiting hospitality premises where food or alcohol is served, or any theaters offering live performances of music, dance, or other art forms as movie theaters to 50 people or to 50% of the capacity of this premises, whichever is less. These establishments must also be able to ensure social distances of 1 to 2 meters between their customers. I'm ordering the immediate closures of all bingo and gaming events. All wellness centers offering physical activities, gyms, fitness centers, and athletic clubs and training facilities will be closed. We are taking these steps to ensure people make changes to their day-to-day lives, which you've already seen many Manitobans do. This is to strengthen our message regarding the need for social distancing and the need to act now. With these orders in place, Manitobans have a clearer message on the roles that they can play to protect themselves, the people around them, and our communities. The total number of lab-confirmed positive and presumptive positive cases in Manitoba remains at 17 at this time. Public health investigations remain ongoing on many of these. Of the 17 cases, we know of 1 individual who remains hospitalized in stable condition. We have added a page to our website that lists the dates, flights, and affected seats where people may have been exposed to someone who later tested positive to COVID-19. This information will be updated regularly as we receive more information. To date, more than 3,354 tests have been performed for COVID-19 at the Chatham Provincial Lab. Pharmacists are being required to limit the number and quantity of prescription drugs being dispensed. This is being done to ensure continued supply and prevent the stockpiling of prescription medications. Only a 1-month supply will be provided at this time. This applies to all prescriptions regardless of whether the patient pays or has a private or public drug plan or pays for that prescription. Please remember that all returning international travelers must self-isolate for 14 days upon their return to Canada. They should monitor for their symptoms closely of fever, cough, respiratory symptoms, and call HealthLinks should those develop. We know that in Canada, and certainly in Manitoba, the vast majority of cases relate to international travel. So please, all individuals returning from international travel, self-isolate, monitor for symptoms, call HealthLinks should you develop symptoms. On that note, we'll talk about testing again. It should be clear that people without symptoms do not need to attend for testing. People without symptoms should not be swabbed for COVID-19 by healthcare providers. There is a strain nationwide on lab testing. We want to ensure the right individuals are being tested, and that's only in Manitoba currently returning international travelers within the last 14 days who have symptoms of respiratory illness. And then, of course, individuals who have been notified that they are close contacts to a COVID-19 case and who develop symptoms. People without symptoms do not need to be tested. As always, our messaging includes frequent hand washing, coughing, sneezing into your sleeve, and if you have mild illness, stay home. Right? If you're sick, stay home. Call HealthLinks if you have questions. Call your healthcare provider if you have questions. But if you're sick, please stay home. A few days ago, we put out the call for people to donate blood. We know that the need for blood does not end during a pandemic, and we've been quite reassured to see some of the response to that, but we continue that call out. It's safe to donate blood. If you're able to, please consider to do that. I would echo the advice of the Assembly of Manitoba Chiefs. Please cancel non-essential travel to northern or remote First Nation communities at this time. I've personally met with many First Nation organizations and leaders and have asked all regional health authorities to work with communities to plan their response to this pandemic. I want to remind Manitobans that we are not helpless against this virus. Many of the steps we've already taken are going to limit the impact of this virus on our communities. We want to understand those roles as an individual. So to protect yourself, wash your hands frequently, don't touch your face, cancel or postpone your travel. Now is not the time to be traveling. Now it's the time, if you can, to stay home. We want to protect the people around us. Cover your cough or sneeze. Avoid large crowds. Disinfect surfaces regularly. And lastly, we want to protect our community, protect Manitobans. Practice good social distancing as outlined over the last week, now outlined in the orders under the Public Health Act. Stay home if you're sick, cancel events, and very important, use reliable sources for your information. I want to reiterate that now is not the time for business as usual. Now is the time to make changes to our day-to-day lives, to work on these social distancing strategies. We have been quite proactive in Manitoba and will continue to do so. But together, all of us working on our roles, we know that we will limit the impact of this virus together. And I want to thank all Manitobans, certainly the frontline healthcare workers that are helping with our response, and everyone who's done their part to limit the impact of this virus. So thank you very much. I'm going to pass that over to Lanette now.
So yesterday, a colleague of mine reached out, Dr. Chris Christodoulou, who's the head of anesthesia for the province of Manitoba, and he shared with me a message that he posted on his university webpage, which I want to share with you. It reminded me that along with all the physical and intellectual efforts that are being exerted to plan and mobilize resources, there's also a mental readiness that is required for our healthcare providers. So what he put on his webpage was, "We are about to embrace the unknown. Our individual and collective team efforts in the service of patients and families will be a defining moment in our history. I believe in you, your courage, and your humanity. As proud Manitobans and Canadians, we stand united together as a health workforce to take on a generational challenge in COVID-19. So I just want to remind everyone, both the providers and the public, that we are all in this together. So thank you for your cooperation over the last couple of weeks. So I'll just run past the updates in terms of statistics for you. So HealthLinks received a record 2,400 calls yesterday, and the average wait time is a little bit lower, 1 hour and 15 minutes. From 2 days ago, that's really an hour less than what it was. So hopefully some of the tools we've put in place are starting to work. We've added a number of new lines, so there's the ability to take more calls. The online self-assessment tool received almost 30,000 hits yesterday, and we are up to 186,000 hits since its launch on Tuesday. And as well, a French version of the tool should now be up for you. In terms of community access testing sites, so nearly 3,000 people have visited the community testing sites throughout Manitoba. Yesterday specifically, there were 422 visits. A 10th location is opening today in Steinbach at 365 Reimer Avenue, and it is Manitoba's second drive-through testing site. The hours for Steinbach are from 9 a.m. to 3 p.m. 7 days a week. Additional locations throughout the province will be opening in the next few days, including a second drive-through site that we mentioned yesterday in Fort Garry area. A reminder that these are not walk-in clinics. People need to have a referral to visit these sites, and not everyone who visits the sites is going to be tested. Manitobans are asked to call health links to receive instructions as to whether they need to go for testing. As well, the members of the public can also look at the online screening tool. Remember that only those Manitobans with respiratory symptoms and international travel within the past 14 days need to be tested at this point. All other Manitobans are asked to stay at home if they're ill. And so just a few things that are changing from the operation systems perspective. Elective surgeries. So starting on Monday, surgery programs across Manitoba will begin suspending non-urgent select surgical slates. This is being done as part of our ongoing efforts to protect the health of patients who can wait for surgery without any negative clinical impact for their surgery. Making this move will allow us to allocate more resources to our response for COVID-19. It will also reduce the risk of exposure to COVID-19 for patients who can safely wait. Hospitals across the province will continue to see scheduled surgeries in a number of essential and time-sensitive areas, including cancer and trauma, some select vascular and cardiac procedures. Time-sensitive orthopedic, obstetrical, gynecology, and ophthalmology surgeries will also continue. Surgical leadership within each health region are assessing all scheduled surgeries to determine what can safely wait. Patients will be contacted directly, likely starting this afternoon, if their surgical procedures will be affected. If they are not called, patients can assume that their surgeries will go ahead as planned. We will reschedule all postponed surgeries when the demand of COVID-19 have passed. Another change that will be happening within the health system, Cancer Care Manitoba. For the next 4 weeks, Cancer Care Manitoba will consolidate 2 cancer clinics to offer services out of 1 location. Services offered at Seven Oaks General Hospital will begin being delivered out of the Victoria General Hospital Cancer Clinic. Affected patients will be contacted by their clinical team and provided with additional information. And visitor restrictions at all Manitoba hospitals facilities were suspended yesterday afternoon. We have received an outpouring of support for these from organizations and individuals. Sorry, got my notes mixed up here. I want to remind with the restrictions for the facilities, they are no visitors except in pediatrics. Cancer Care Manitoba will review on a case-by-case basis, and all situations we will consider the individual situation and the circumstances that go around with that. And then just in answering a question that came out yesterday about how the community can support one another right now during this outbreak, we have had a lot of people offer support, and we've set up a website, community@sharedhealthmb.ca, where COVID-19 related contributions will be brought together and organized. We can help direct where the greatest need is for donations within the communities. So I think that is it for me. I'm sure you have lots of questions, so we'll open it up.
4 p.m. today. We sat here with you yesterday and you weren't ready to make a declaration like this yet, even though we were seeing it in other provinces. What was the determining factor to say now's the time?
Well, it was on the table at that time. We were discussing it, and certainly the decision was to not so much as anything has changed here in Manitoba, but just the dynamics around us in the U.S. and other jurisdictions in Canada. We wanted to remain to be ahead of this, and so that's why we decided to initiate this now.
How will it be enforced?
Yeah, so certainly the Public Health Act makes it an offense to contravene any order given, and there are methods to enforce it. We enforce other orders through public health inspectors, even peace officers is a possibility.
Are we going to be having people actively searching this out, or are you going to rely on public, like the Premier said, naming and shaming people to say, you know, it's unacceptable? Because I know as media organizations, we're getting it daily from people sending us emails and pictures of businesses or people who aren't abiding by what you guys are very sternly asking them to.
Right, so as almost always, Manitobans will follow our advice, and we see that just giving the advice last week. We see many organizations, many individuals following suit. Now having it an order under an act, we expect even more people to comply with that. And if we have reports of individuals or organizations that are putting the health of the public at risk, then we have abilities to enforce that.
What does that enforcement look like?
Well, it's provided under the Act. The Act makes it an offense to contravene any order, and so it can be fines or even a term of imprisonment under the Act.
Will municipal law enforcement be engaged for this purpose?
It's possible. Right now we are putting this order out. We'll have to see what kind of response we get. We typically have things under these Act, enforced or inspected by our public health inspectors, which we will look at. The Act allows for certain orders to be involved with peace officers, but we would certainly engage with them before we went down that alley.
What is the fine if somebody doesn't abide by this and is enforced?
Well, for an individual, it gives a range. So the fine is not to exceed $50,000 and a term of imprisonment not to exceed 6 months. But that's in an act in general.
And that could be for a business as well, or would that be higher for a business?
For a corporation, it's not to exceed $500,000.
So this essentially gives teeth to any directives or to any guidelines you issue.
Correct. The orders that I issued today, as outlined there, they are orders under the Act, and it's an offense to contravene them.
Will schools be open closed, for 2 weeks, or is it 30 days now?
The school issue is not dealt with under this order. That's been dealt with already, so we have that time frame, the 3 weeks beginning today, and then that's something that we'll continue to review over time.
Are you surprised that it hasn't gone up from 17 now? We've sat here a couple days and we got that extra I believe it was 2 evenings ago. And I think a lot of people, given the nature of how much more testing is being done, expected that we would start seeing a quicker rise.
No, I'm not surprised by that. I wouldn't make anything of the day-to-day variability. We expect that very early on.
Are all 17 for sure linked to travel?
The one that I mentioned in the past, there's still information coming in regarding that one. So right now it is not linked to travel.
Does that make you think more that it's towards community transmission?
There's a number of factors with this case that doesn't make me want to go that way right now to say this is community-based transmission, but we are looking at that.
Lanette, how many resources will be freed up by canceling these non-essential resources? Do you know?
Well, we're going to take a gradual approach right now, and so with every OR slate that's closed, it does free up quite a few nurses, an anesthesiologist, and a surgeon to redeploy to a different area. So it kind of, we'll have to look in the totality of how many are being canceled at different sites. So there might be 2 here, 3 there. So it'll be significant, and there's the opportunity to span that up as well.
What do we know about smoking and vaping and the outcomes of COVID-19?
I don't know if there's a lot of specifics out there. Those are things that we would strongly recommend against, period, for health. And so That's the general message with or without COVID-19 is to find ways to reduce or eliminate those actions.
Manitoba Nurses Union today raised concerns about health workers who have traveled. Apparently there's an exception for those workers who may be called into work without isolating for 14 days. Are you giving any thought to reconsidering requiring people, health professionals who've not isolated for 14 days, having managers decide that they have to go to work?
Well, we're always reconsidering all of these things depending on the how.
Stop this.
Right. Yeah. So all these are the balance, right? So it's so with the daycares, the call to end childcare for some that seems very obvious until we know the impact it has on our front care providers. It seems very obvious to say everyone has to self-isolate for 14 days until some essential service has to be stopped because of it. So.
Nurses infect other nurses because they didn't self-isolate.
Well, it's not just a blanket return to work, right? It's people would take extra precautions. There'll be a risk assessment based on the travel and their contacts. They would have to self-monitor their symptoms very closely daily, twice daily, and would be required to wear a mask while at work in the incubation period. So
there's conditions on anybody, a nurse, let's say, who is traveling abroad, who's come back, who's called into work before their 14 days are up. You're saying that all these other conditions on their work.
Exactly, and they still require to be assessed by occupational health and safety to do a risk assessment, and then if they're deemed to be able to come back as an essential worker, those extra precautions need to be taken.
Lanette, you said there were more lines added to health links. How many are we up to now?
I didn't get the number. I think that's 104 overall have been added, but they've been, with the screening tool, I think it's taken some pressure off of it. And they've been also the IVR, the interactive voice recording, has been on and off. It's not quite stable yet, but I think it's been helpful as well.
How many people are we seeing presenting that are not having that recommendation to go there? Our health links and our drive-thrus now being inundated with people showing up that shouldn't be?
No, actually, I think people are hearing the message. The numbers went down a little bit in Winnipeg at the access centers. So, it's in the hundreds for sure, the people who come, but I don't think it equates to the same number of testing. So the proper screening is being done, and as people can identify, should they be screened, do they fit that criteria, it can save them a drive unnecessarily if they can get the direction they need.
How strained are we? I know you talked about there being a strain on the system nationally. How much of a strain are we under right here?
With lab testing?
Yeah.
Yep. So there's a short-term strain right now that has been dealt with some more capacity even today. And we're looking at, by hopefully next week, back onto our previous capacity.
Capacity of people that are able to conduct the test or to actually?
This is specific to the running of the test at the lab.
A quick question on community transmission. We're getting questions about it. Someone kind of called Health Links because they developed symptoms of COVID-19. They've been in contact with someone who traveled internationally recently and did not self-isolate. Whether or not that person had the virus is kind of, they didn't know. So they called Health Links, and Health Links said you should go get screened, but when they got there, they were turned away because they themselves didn't meet the criteria. What is your reaction to that?
At this point right now, we are looking more at the highest risk individuals because we need to maintain the ability to find those. So we know that the vast majority of our cases are linked to travel. So that's where we need to focus right now. When we open it up to contacts of somebody who may have traveled, who may have been symptoms but weren't confirmed cases, we're going to lose our ability to test the appropriate people.
Could the lab be expanded?
Well, it already has, right? So the capacity of the lab to test for this COVID-19 in such a short period of time has been quite remarkable, and so we continue to look at that. But there's been many inputs into that lab to allow the testing to be expanded.
People are concerned and wondering, should I go see my loved ones, my parents, my brother, my sisters, just in a home, in a little environment? Should I still do that? And what would be your answer to that?
You know, we give these broad recommendations to it. It's very hard to start analyzing specific scenarios like that. The idea is that this is a time for social distancing, not social isolation, but social distancing. And when you have people who might be at increased risk of this, people over age 65, immune compromise, underlying medical conditions, we want to limit the ability to spread this virus to them. And so does that mean that no one can ever go visit their family? It's tough to give specific things, but in general, now is a time to stay home if you can, and really take care of the people who are at high risk.
What's your people say, like, act as if you already have it? Is that a good advice?
Well, it depends as long as that doesn't, fear and panic is contagious. We see this fear buying. We've made regulations now with pharmacists to stop the, hoarding of medications and things. So we don't want that message to be out. But all of the social distancing strategies have that built-in safety, right? If you stay home, when you're sick, or even stay home when you can, the chances of you acquiring or spreading it to other people is dramatically reduced. If you're out in public, whether you act as if you have it or not, but just staying that 2 meters from anyone is going to dramatically reduce the chances that if you had mild symptoms that you could spread it to somebody, and dramatically reduce that anyone else could spread it to you.
What's your overall?
Sorry?
That traveler website where people can find their flights, is that up and running yet?
That is on our website.
And so people are going to look at this, and if they're on the plane, what's the message to those people that may not have the symptoms but were in that plane or maybe in the general vicinity?
So if you were an international traveler on an international flight, it shouldn't change anything you do, because you should be self-isolating and self-monitoring for 14 days. If you only traveled domestically and found yourself in there, then I would advise you to self-isolate for 14 days.
The doctors in isolation, what did they do? What's the effect on the healthcare system?
The doctors that are right now in self-isolation?
Self-isolation that were at the curling bonspiel they attended the day the pandemic started.
Okay, yeah, I can't speak to any specifics there. In general, physicians, nurses, any healthcare providers, if they were close contacts of a case, they're going to need to self-isolate.
We know they're in isolation. Can you tell us what the effects of the healthcare? What did those doctors do? Doctors Manitoba confirmed that there were 3.
No, I can't discuss the specifics.
What's your overall assessment on how Manitobans are reacting to this crisis, and are Manitobans listening, or what's your general sense?
I do think that. I think that Manitobans are taking a calm and learned approach to what's going on right now. I think they're taking measures into their own hands. I think they realize that we're not helpless, that the actions that they take now can make that big difference. And and the orders today are really just to enhance that, to ensure we get the message out that this is not something for someone else to do. This is not something you should do in a couple weeks. The time to act is right now.
Given the messaging that you've been, just going back to that whole the curling thing, and given the messaging that you've been reiterating every day here, how concerning is that to hear that doctors were traveling for? People who you would think that you would have a higher standard in terms of what they're doing.
Yeah, well, I mean, I think just in general, this is a challenging time, and everyone realizes that. But I think that everyone should just continue to review those roles. And so the travel, I would say now is not the time to travel. And I think that we all learn from things like this, and we see examples of this, and then hopefully all Manitobans can see that this isn't a time to travel, this is a time for social distancing.
On that note, should people who engage in domestic travel be self-isolating upon return?
Not self-isolating, but for a specific exposure. That hasn't happened right now. But I would, my advice is that now is not the time to be traveling. If we're giving the advice to stay home if you can. So I would say think strongly about even domestic travel right now.
Yesterday, you responded about saying you had a lot of stocks of the swabs for several more weeks. Are more on order?
Yes, yes, and that's a national process that's been working that out.
Now, Alberta, they've created a pay structure to enlist pharmacists to do some testing. Would this be possible to help expand testing here?
No, nothing is off the table here as things develop and we need to expand sources. We know that many Manitobans have been stepping up, many healthcare providers have been stepping up, so I sure wouldn't take that off the table here.
Now, you've been asked before about expanding testing. You've commented already about the capacity at CADM Lab, but what we've seen in places that have been incredibly successful at hammering the curve, not just flattening it, Singapore, Hong Kong, Taiwan, South Korea, they have engaged in community-wide testing. When and what steps need to happen when larger, broader community testing can take place?
So that's the capacity at many levels, right? The capacity to assess and swab those people, the capacity to have the swabs and the viral transport media, and then of course the capacity at the lab to reach that. So we'll keep striving towards that. But remember, all of the social distancing strategies also take that in consideration, right? So we don't need to swab asymptomatic travelers, because asymptomatic travelers should be self-isolating at home for 14 days. And so there's a lot of built-in things to this strategy that also protects that.
The number one question I think I'm confident saying everyone in this room receives is, how do we know it's not in the community? If not, you've answered the question repeatedly, but what do you do to reassure Manitobans who are paying attention that you're on top of the community transmission issue even when you're not testing people outside? Sorry, Rich.
Yeah. Well, I would say one thing that I can tell you is that we're not seeing people show up in hospital, and our ICUs are not overflowing with this. And if they were in ICU, we would swab them and see that they were positive, and then we would trace them and find out. So on that end, we're not seeing an influx of people coming in with those symptoms. So. And
then I would note is the one case that we're still trying to link travel to shows that, well, we are testing some people that without direct travel history. So we do have methods of picking up some community transmission.
In that case, is it still the thought that there is travel involved in it, or have you moved past that?
Yeah, well, we've actually, there's still ongoing investigations on there. And so I'm not calling that a community-based transmission, certainly not sustained community-based transmission. So we're still looking at that particular
I
case.
asked yesterday why it's taken so long. I'll ask it again today. Why is it this one so different than
So the important things are the things that didn't take long is to identify the case, to isolate the case, and to identify close contacts and isolate them. So that didn't take long. It's just this extra process of this early on in the outbreak, we take extra measures to try to link it to either travel or link it to a case. And there's some factors that that are not concerning, but I can't discuss them here. That makes me still not think this is community-based transmission.
Can you respond to the MNU letter? I know that you were asked twice already this week about the difference with the returning healthcare workers being in a different form and the process that they are screened, but the MNU sent a letter concerned about the differences and concerned about the change in procedure, and I'm sure you're aware of it. Could you please respond to it?
Well, about them going back to work after travel. So if they're asymptomatic and they've been self-isolated for 2 weeks, they can come back to work. If they are an essential service that not anyone else, they're irreplaceable basically, those would be the exceptions where we would ask an asymptomatic staff person to make sure they were wearing their mask and were not in contact with high-risk patients, and continued follow-up with OSH. It's not the ideal situation. We would never do that if there were other alternatives.
The MNU asked, quote, "For the safety of all Manitobans, we call on your government," I understand you are administrators, "we call on your government to immediately reverse this decision and respect the 14-day self-isolation period for healthcare providers."
Well, that would be the general rule, to do that.
I just want to clarify on the one case that's not absolutely known whether it's community or travel. You said an answer, I think, to my question that it's possible it's community, but then you indicated a minute ago that you don't believe it's community. Is that
Right.
where it stands?
That's where it stands right now, and so this is part, I want to be as transparent as possible. The other cases, we could immediately link them to travel, there is no doubt. This one here, we're not, so I want to put that out there to ensure everyone knows that we can't link this one to travel at this point, but there are factors with this case that aren't concerning, that make me believe it's not community-based transmission.
Thank you.
Anyone else? I've got one more. Are you looking for alternatives to staffing health still?
Alternatives in terms of people? Yeah, I think they're actually doing pretty good right now. We still have some more technological changes to implement, but I think it'll be ongoing. A lot of these people, we have students, we have retired nurses, we'll want to keep refreshing and finding people. The other thing that we will start looking at very soon is the central contact and surveillance unit that for COVID-19 that we spoke about yesterday. It was just approved, but we'll need some people resources in there to follow up on those contact tracings and day-to-day check-ins.
One last question. The capacity, I keep saying one last, pardon me. The capacity on buses is often more than 50. Given that restaurants that have a smaller than 50 capacity are being looked at dropping it to half capacity, would you recommend every 2 rows on bus? What's the protocol for public transit now?
So
Not a
right,
lot of people on them, but-
right, yeah, and that's the thing is that with all of the social distancing strategies going on right now, we're thinking that that's already been taken care of. We're not seeing a lot of crowding on there, but any further specific recommendations to transit will, of course, need to engage with the city municipalities to decide that.
That's it. Thanks, everybody.
Thank you for your patience.
So, Mr. Wright,
Not really.